Welcome to your feedback session. This was the Neurodivergent Identity and Comprehensive Experience Index, the NICE Index ADHD assessment, and we went beyond DSM diagnosis. The DSM is a starting point, but it really should just be a starting point. Some conditions that aren't officially recognized in the DSM that are common among neurodivergent individuals will subtly but significantly impact quality of life. And traditional assessments miss these key factors. So a diagnosis is only one piece of the puzzle. We go deeper. First off, we looked at sensory processing differences or sensory integration. And this involves differences in how the brain receives, interprets, and responds to sensory input. And someone may be over-responsive or under-responsive to different stimuli and across different realms of different stimuli. So sound, touch, movement, smell, taste, etc. And this leads to discomfort, anxiety, or functional challenges. It can affect daily life, mood, cognition, and participation in social and work environments. So there's a difference between a sensory preference, which, you prefer things to be a certain way, but it doesn't actually have a negative impact on your ability to think or problem solve or make decisions. Whereas a sensory need, if it is being violated or the need isn't being met, it's going to impact your energy, your mood, your ability to problem solve, focus, pay attention, etc. So you can see the difference between a preference and a need. And alexithymia is a sensory processing difference, and this is where there's a difficulty identifying, expressing, and understanding emotions, which are a sensation. That can lead to struggles in relationships, increased stress, and mental health challenges due to processed emotions. Also, it can impact decision making because most of the decisions that we make are informed by our emotions, and social connections and overall well-being. And then alexithymia is where there's difficulty recognizing, interpreting, and describing bodily sensations. And this is known as interoception. So it's harder to identify the signals of pain, hunger, thirst, or cues for when you should go to sleep or when to know that you're stressed. And this can contribute to health issues, anxiety, and unmet physical needs, and it can impact overall well-being and self-care. So we looked beyond the DSM, and we also looked beyond deficits. So this was a strength-based approach. We also explored different aspects of personality and attachment and things like that, really to try to give you a sense of who you are. The NICE index also looks beyond ADHD. Why? ADHD is a neurodevelopmental difference, also called a disorder, right? And that means that genetics have combined with environmental factors to create differences in how the brain and the nerves develop and then interact with the body, relative to what is considered typical. And neurodevelopmental differences often travel together and have a lot of overlapping manifestations. So common neurodevelopmental differences and things that we screened for: ADHD, autism spectrum, and dyslexia and other learning disorders. So ADHD and autism, how do we define what is ADHD and what is autism? Because, really, we hear everybody say, well, isn't everybody a little ADHD and a little autistic? Sure. Many of the ADHD and autistic manifestations can be a universal part of being a human being to a certain degree. So it's really how far from that average person here in the middle do the intensity, frequency, and duration of those manifestations land for you, and then what's their impact on your quality of life? Because that is where traits become disorder, when they result in harm or negative impact to the individual and then often those around them. So what are the traits and manifestations? What is ADHD and what is autism? ADHD is differences in nervous system development, which result in a lifetime but situational pattern of having an interest-driven nervous system with the ability to hyperfocus. Okay, so this is where attention comes in. ADHD is the worst named disorder ever on the planet. But because no person with ADHD has ever had in a deficit of attention. We have a surplus of attention. We just have a difficult time regulating it where it needs to go and when. And the ability to zoom in on something and hyper-focus on it to the exclusion of other things. And then impaired response inhibition. Again, this is attention, and here we bring in the hyperactivity part, impulse control. So response inhibition means to stop responding. And so this means stop noticing things and reacting to things. And we have a difficult time doing that. Impaired verbal and nonverbal working memory. This is the ability to hold visual or verbal information in mind while you're doing other things. Impaired emotional regulation, which then results in behavioral control. So this means like being able to do the calculus homework despite how you feel about doing the homework, or being able to not buy that pair of shoes despite how you feel about how you think those shoes would make you feel. And that impaired planning and organizing towards the future. And this really means sort of like maintaining a system of organization or a system of planning, or developing a plan and then sticking to it towards what you really intended for yourself. And this all results in executive dysfunction, and it has to result in a negative impact across two realms of your life. Autism it's not a single thing. Autism is a word we use in an attempt to capture a spectrum of strengths, differences, and vulnerabilities. And this is a quote by this pediatric psychiatrist, autism researcher. So what autism is its differences in nervous system development, which again result in this lifetime, but again, situational pattern of social and communication differences from what would be considered, typical. And in order to meet the criteria of autism, we have to meet 3 out of 3 in this particular group. So differences in social reciprocity, sort of give and take in interactions. Differences in nonverbal communication, and this can even just be your experience of eye contact. Differences in relationship management. And then repetitive or restrictive behavior. This is category B, or criteria B of autism. Again, different from what is considered typical. Here we only need 2 out of 4 to meet the criteria for autism. So circumscribed interests, deep interests that have gotten in the way of perhaps other important things, such as reading so much, being so interested in reading that you bring your book to the dinner table, or you read instead of going to sleep at night, or you're reading a book during math class, those kinds of things. Mental preference for familiarity or sameness. You'll see this also described as cognitive inflexibility, but we're trying to move away from these sort of derisive and derogatory and pejorative ways of describing this. So having a preference for things to be done in the same way each time, that type of thing. And then repetitive or idiosyncratic behavior. Repetitive could be reading that same book over and over again, watching the same TV show, watching the same movie, listening to the same song. And then you loop in your circumscribed interest by you listen to the same songs by the same person, let's say Taylor Swift, and you also know everything there is to know about Taylor Swift, right? Or idiosyncratic might be making up words for things, or talking in funny voices, that type of thing. And then sensory processing differences. How your nervous system develops is going to influence how you perceive, experience, and respond to the world in every aspect of life. So thinking about sensory perception and responses, cognitive processes. This isn't intelligence, but how you use your intelligence. Social impacts, and physical well-being, right? Because your nervous system is a part of your body. It's not some separate, isolated thing. It's all one. So let's look at the influence of ADHD and autism on these realms and how they develop and overlap. In other words, why we looked for both. So the influence of ADHD and autism on sensory perception and responses. So this is noticing and responding to, okay? Where we overlap is we notice and respond to our interests a lot more and for a longer period of time than our typically developing peers. Both ADHD and autism are interest-driven nervous systems. We notice and respond to emotions differently, sensations, both internal and external, rewards and pleasure and motivation, which all of these things are tied together, right? And then what separates ADHD is noticing and responding to having a lot of internal thoughts. That's the cognitive hyperactivity. And noticing and responding to time, the ability to estimate how long things should take, the ability to notice time passing, and then being driven by what is happening right now versus what you really wanted for the future. And then what differentiates autism is perhaps the intensity or typicality of those interests, and how autism shows up subtly for a lot of people, especially females, is that the interests are typical and they are absolutely socially acceptable, but they are at a level of intensity that is beyond what would really be considered typical, but perhaps that's kind of hidden because it's become your academic, social, and occupational currency. In other words, let's say your special interest is people. And so you have spent your life trying to understand people. And so then you studied psychology, and then you became a therapist, or perhaps a nurse practitioner, and then you discovered ADHD and autism, and that is your special interest. And maybe it doesn't appear all that abnormal, except that it's all you can think about, dream about, you eat, sleep, and breathe it, right? Okay. Desire to carry out repetitive behaviors. Again, this is just the watching the same show over and over, wanting to do things in the same way and do them over and over. That could also be picking at your skin, biting your nails over and over, twirling your hair. There's all sorts of ways that shows up. The influence of ADHD and autism on cognitive processes, again, not intelligence, but how we use our intelligence. So where we overlap is the impact on thinking, making decisions, planning, problem solving, prioritizing, organizing, our memory, regulating energy, psychomotor coordination, right? So how your handwriting is, how well you tied your shoes and how long it took you to learn how to do that, your ability to navigate around through your apartment or your house without bumping into everything, dropping stuff, right? Driving, that's psychomotor coordination, learning differences. And this could be, this runs the gamut. This could go from having dyslexia or dyscalculia to having intellectual giftedness, and functional adaptability, which is the ability to just keep up with the daily to-dos. And that has nothing to do with intelligence, which is very frustrating because most of the world believes that it does. And so when your intelligence outpaces your functional adaptability, that is very confusing to everyone. What differentiates ADHD in this situation is probably more around regulating alertness and arousal. So being sleepy in boring situations, hopefully not right now, and being a little too arousable or excitable in others. The volume of your voice getting louder and louder as you become more passionate about something. And then cognitive flexibility in autism, that having more challenges with change is probably more on the autism side. The influence of ADHD and autism on social impacts, where we overlap, is probably the amount of rejection that we receive and our response to it. Differences in communication, probably for different reasons, as well as relationship management. Perhaps in ADHD, it's because you forget that people exist when you aren't with them all the time. And then also in ADHD, so looking at what differentiates there, is maybe social situations are more impacted by verbal and behavioral impulsivity. So blurting out an F-bomb in front of your boss on the first week of the job. Guilty. And then just attending to social cues, like being able to pay attention to a conversation long enough and hold your thoughts long enough until it's your turn. And then what differentiates autism is there is a reduced intuition for unwritten neurotypical social rules and cues. So having to use cognitive processes, not subconscious, this doesn't happen in your subconscious, it's actually happening up here in your consciousness, to navigate different social situations, having to put energy into it. Because the truth is that for non-autistic people, that doesn't have to happen up here. That happens subconsciously because these things are innate human traits. And then if you have to use cognitive effort to navigate social situations, right? We all code switch, but there is a different level of effort involved in code switching when you are autistic. And so that then results in differences in social motivation and endurance. Maybe you don't have as much motivation to spend a ton of time with people because your endurance to do so is perhaps impacted. Maybe you have to do a lot of preparation and then need a lot of recovery time for different types of social interactions. And often it's going to be the cross neurotype interactions. So when a neurotypical and an ADHD are interacting, there's going to be a lot more misunderstandings, a lot more misreading of social cues and nonverbal language and all that stuff. And that can be confusing and exhausting. And then physical well-being, the impact of ADHD and autism on physical well-being is tremendous. Take a look at this, right? Where we overlap is most things, and all of these things are mediated by the genetics associated with ADHD and autism. These aren't lifestyle factors. That's a whole separate slide, but we're not doing that. We're just looking at, okay, what does just being a person with an ADHD or an ASD or an ADHD neurotype mean for your body? So allergies, mast cell activation syndromes, autoimmune disorders, chronic fatigue for sure, pain disorders, connective tissue disorders, the Ehlers-Danlos, neurological concerns like migraines, epilepsy, gastrointestinal stuff, IBS, constipation, autonomic nervous system dysfunction. This is, POTS, if you've ever heard of POTS, or where it's just difficult to regulate your body's blood pressure and heart rate in various situations, like after a hot shower or after a big meal or when you've been standing too long with your knees locked, that kind of thing. Hormonal, endocrine, and metabolic concerns, PMDD, really bad periods, having diabetes, obesity, sleep issues. Delayed phase sleep syndrome is so common in ADHD, 76% of us will experience it versus 4% in the neurotypical population. That's practically a biomarker. Cardiovascular concerns, dental concerns, and not just because you resisted brushing teeth as a child. Genetic alterations, microbiome alterations in the gut, and all of these things, a lot of these things, is the chicken or egg scenario. And then what differentiates ADHD? Maybe we are more at risk for COPD, which is chronic obstructive pulmonary disease, emphysema, and chronic bronchitis, and not just from smoking. Musculoskeletal concerns, we're more at risk for osteoarthritis, not rheumatoid, which is the autoimmune type, but osteo, just the wear and tear, and prematurely. And then genitourinary concerns, kidney stones, bladder infections, skin conditions, eczema, psoriasis, restless leg syndrome. And then in autism, there's more association with gross and fine motor disorders. So dysgraphia, which is difficulty with handwriting, and perhaps your handwriting is atrocious, but not just that. It may also be that it is you hold your pencil or your pen in an unusual way, and it hurts to write after not very long. Hypotonia, maybe when you were born, you just didn't really have a ton of muscle tone and you couldn't hold your head up for a lot longer than what was expected. Dyspraxia, are you super duper clumsy? Right? Do you trip over your own feet? Apraxia of speech is, and you can have dyspraxia of speech as well, which I certainly struggle with, where I'll stumble over my own tongue. Or apraxia of speech, difficulty getting words out, nonverbal autism. Tics and Tourette's, hyperkinesia, where you move too much or too fast. Bradykinesia, moving too slow. Motor perseveration, doing the same repetitive motor actions over and over. Oculomotor dysfunction, having presbyopia or like a lazy eye. Strabismus is lazy eye. Presbyopia is being nearsighted. And then many more things. So how did we evaluate if there are or have been impacts of neurodevelopmental differences on these realms in your life? So the key factors of a neurodynamic quality of life, to me, are we need to look at personal, social, emotional, and sensory measures. We need to look at cognition, thinking, and learning measures, or at least screen for learning things. Look at well-being measures. How have all of these things impacted your mood? We need to look at really universal functional adaptability measures, physical symptoms and conditions, and then finally we look at diagnosis specific. And all of this is just about understanding you. The point of this diagnostic process is not to pathologize in any way, although I do not live in the camp that believes that pathology is a dirty word. Pathology in and of itself is neutral, if not empathetic. Pathology means the study of suffering. To acknowledge the suffering that is involved in these neurotypes is empathetic, right? Okay, when people rail against pathology, what they're really railing against is neuroableism, but nobody really knows what that is. So they go with what they know. And we'll be talking a lot about what neuroableism is as we move forward. But this is really a process to help you discover a more complete picture of you, to understand why you experience the world in the way that you do, and why that seems different to what other people seem to experience. And to help you uncover and integrate, if you have any inner masked self, with your outer self so that you can live as your whole authentic self, and ideally do that in a safe way. So this was a collaborative exploration of identity, not just an ADHD evaluation. So let's dive into your results.